So today with us on What's Wow Now is Dr. Susan Malinowsky, and we're really grateful to have her here. She's a special guest, and she's going to be talking about treatment of the eye, because there are a lot of innovation and preventive medicine that we all don't know about, and we want to get it out to the mainstream. Thank you for being with us today.
It's my pleasure to be here, Lois. Thank you. There's so many new and exciting things that are happening in ophthalmology in the treatment of eye diseases, and I'd like to talk to you a little bit about that today. In my area in particular, I'm a vitreoretinal surgeon in the Detroit area, and that means that I deal with people who are either going blind or already blind in one or both eyes. When I was growing up, I remember seeing people who had white canes and they weren't able to function in society, and today we've changed that completely, and especially in the last 5 years we've seen dramatic changes. But unfortunately, a lot of the problems that we have with treating these patients is they don't come in on time. So I want you to understand that it's very, very important that if you have certain problems that you see your eye doctor and make sure that these things are addressed early so that people like myself, retina specialists, and other subspecialists in ophthalmology can help you. First and foremost, macular degeneration. Some of you may have heard some ads that have started on the radio recently about symptoms associated with macular degeneration. Macular degeneration is the #1 cause of legal blindness in people over the age of 65 in this country, but we hope to change that statistic. And macular degeneration affects healthy people. You can be in perfect health, have no other diseases, and all of a sudden the central vision is lost. The symptoms to look for: wavy lines, distortion, especially in one eye. So you're looking at something that should look nice and straight, like a picture frame with blinds. All of a sudden the blinds are wavy and distorted. You need to get on the phone, call, have it checked. How we treat this depends upon the type of disease that you have and how advanced it is, but we have treatments including medications that can be injected into the eye, and it's completely painless for those of you who are concerned about that. And we also have laser treatments, and the treatments are very, very successful, essentially taking a disease that just 5 years ago resulted in blindness. Now you can drive a car, you can balance your checkbook, you can go to the store, stay functional in our society, and that's a big, big change.
Why do you think most people don't really know about this? When did this innovation happen, and how has it changed your practice?
Well, when I first started practicing, and I've been in practice for about 14 years, I spent my day really just telling patients that I was very sorry that they had a very bad disease. Essentially, they were going to lose their central vision, lose their independence. And now I spend my day treating patients, injecting them, lasering them, and basically keeping them functional. Because the change has only happened in the last few years, a lot of people may know other relatives or friends who lost their eyesight and they're unaware, they're scared, there's denial that occurs, and rather than doing themselves good by coming in early, they wait and then they have more problems.
What has been the biggest innovation that's been happening in eye medicine today?
I think the biggest innovation is the treatment for macular degeneration. The drugs that we use were initially developed for treatment of colon cancer and breast cancer. We use them in much smaller amounts to treat this disease in the eye, again, by injecting it, and it really has been a tremendous change.
Dr. Malinowsky, also earlier you were telling me about innovation with people that have diabetes. Everyone thinks, diabetes, I'm going blind. Can you tell us more about that?
Well, again, diabetes, it's the same sort of thing, that the progress has been so tremendous in what we can do and treat people with diabetes that the diagnosis of diabetes doesn't mean that a person has to go blind and lose their eyesight. But again, as with macular degeneration, extremely important to be checked early when you have no symptoms at all. So if you're diagnosed with diabetes, you need to have a good eye exam, and typically you're seen once a year, even if you're in perfect shape, even if you have no problems at all. We use laser treatments that are painless. We also, again, use injectables in the eye to treat certain problems, and also the surgical advances are much, much more effective than they were even 10 years ago. We use instruments that are extremely small in the eye. The size of the instruments are so small that when I do surgery, I actually can enter the eye, fix the problem from the diabetes, remove the instruments, and no sutures are required, and it's done under an operating microscope.
That's amazing. So the last question is, tell us what the average person, without really any critical problems, what preventive measurements or measures they should take today, and those with critical situations and challenges.
In terms of prevention, in terms of supplements and home remedies.
Lifestyle.
Well, certainly the same things that apply to your general health apply to your eye health. There are a lot of old wives' tales, if you will, about sitting too close to the television or reading with the wrong lighting. Those really are not true. But the things that affect your general health affect your eye health. So obviously not eating lots of candy if you have diabetes, and not smoking, and good exercise and good diet, all of that affects your eye health. And again, if you have any risk factors, if you have any early signs of problems, get it checked. Don't wait until things are broken.
How often should the average person see their eye doctor?
If you are in good health and have no other risks or concerns for eye disease, especially if you have no family history of any eye problems, then once a year is very reasonable after the age of 50, and before that, probably every 2 years. But of course, if you're diagnosed with a problem or you have some other systemic condition that could lead you to have a problem, it would be probably once a year.
Okay, thank you for being with us today. We
My
really
pleasure.
appreciate it.
Thank you.